Practices have to engage the community if we want to improve the health of this country. We worked very diligently on measuring accurately and following up as quickly as we could. And you get to a place on your control rate and you can't bump it. And that's because the power to improve health doesn't live within the walls of the health center. We did a dive into a list of our patients whose blood pressures were not in control to try to see if we could understand what their community consisted of, as opposed to what we thought was their community. There was a national grocery chain that we learned had resources to contribute to community education.
What was great about MedStar is they came with a specific proposal. They knew what they wanted the message to be. We want to teach people how to manage their blood pressure by shopping for healthy foods.
They have been conducting monthly tours and educational trainings with their dietitian for our families here at the Family Health Center.
The grocery store is the perfect place to provide nutrition education. That's where families are making decisions about food. In terms of blood pressure control, we're showing them produce and whole grains and low-fat dairy and low-sodium products and herbs and spices, and teaching them how to make their foods using less sugar, fat, and salt so they can be healthier. So it's an ideal partnership.
If we work together and listen to each other and try to help each other with our priorities, then we're better able to get down to where we're starting to make a difference together.
Enabling the patient to realize that they are in control and that they can take care of themselves makes them able to implement that into other aspects of their life, which is, life-changing.
Patients need to know what a number means once it comes up on their blood pressure cuff. I think once patients own their health as well as know what their sickness is and how they can fight their sickness, I think they feel like they're in total control of their health, and I think that's wonderful.
I think the biggest recommendation is to realize that it's not a one-person job. And that everybody has a responsibility. Not only is the provider in charge, but the CMAs are in charge, the secretaries are in charge, the patient is in charge. And so it really is a team effort.
I would recommend that other practices and ours continue to think like a small town. If you imagine being the provider in a small town, you know your community, you know your people.
The communication and the care you have for them in the office visit, it extends beyond just a 15 or 30-minute visit with a patient, and that relationship that you have with them on the outside really opens the door to making them more healthy.
I would invite practices across this country. It doesn't matter if you're a large residency practice or a small independent practice to get involved with the AMA on the Blood Pressure Project. They've provided resources we would not have had. They've given us ideas that we would not have had. And I think that the reverse is true. We have learned a lot from each other.